All right, so we're going to talk about adult autism now, which is, there are some additional considerations that we have to think about beyond just children with autism as well. All right, so, oops, as always, I'm not on the right thing. So, this is not my lecture. Usually I have a guest lecturer do this. You can see here I have a PhD student in the Autism Brain Aging Laboratory give this talk, but she was not available this summer, so I'll take over. What's great about that, though, is it's a wonderful intersection with speech and hearing and cognitive psychology, which, as you know, is where my background actually is. So we're going to talk about aging with autism. Then we'll talk about some research from the Autism and Aging Laboratory. Pretty much just those two things. So we don't know a ton about what it looks like to age with autism. I was going to say we know a lot about what I was going to say we know a lot about what it is like to be young with autism, and we know more about what it's like for younger people with autism. Obviously, like you learned from Maria, we don't know everything. There's a lot that we're still learning, and every case is a little different, right? You know one person with autism, you know one person with autism. But, like I said, we do know more. Why do we know so little about aging? Well, that's because, like you can see here, the first person who was described as autistic was born in 1942. This is the age of your grandparents, great-grandparents, somewhere in there. Right? So it's the age of my grandparents, I would say, is about there. So somewhere in there, right? This isn't a thing that we've known about forever. This isn't like hypertension. This isn't like diabetes or something like that, where it's been around for a long time. This is something relatively new. So I say that the first person described as autistic was born in 1942, but it wasn't added to the DSM, which if I remember correctly, from Maria's lecture, stands for the Diagnostic and Statistical Manual for the American Psychological Association. It wasn't added to the DSM until 1980. So these people are just a little bit older than me, about 10 years older than me, right? People who might be diagnosed as the first group of people who are diagnosed by the DSM as being autistic. So the first person is in 1942, but it took about 40 more years until we actually had criteria to diagnose these people. So obviously, a lot of these people are not, super old. We're not at like an advanced age yet. Most of them are still, in the working age. You can see here, this is this guy. This is Donald as a baby. He's 84 in 2018, so I guess he's actually 86. He's still around. I checked that out before the lecture. He's still alive, still around, still doing pretty good. 86. So our one data point, the oldest data point that we have, is 86. We've been able to watch him get older and see what happens to people with autism as they get older, but really, mostly this one case. So one other thing that compounds on top of this, you have very few until 1980, then you have more. And then you can see that in 2014, it's 1 in 68 children diagnosed with ASD. I think the current numbers, well, you heard that from Maria, the current numbers. She just looked it up, and The most recent numbers that I've heard are 1 in 62, 1 in 60, somewhere like that. So I think hers and mine are right next to each other. It depends on the reporting agency that you look at. But so the diagnosis is rising. Well, why is it rising? Does that mean that we have more autism or more people autistic? I mean, it could. It could be that there's some environmental factor that's leading to it. I'll tell you what, it's not vaccinations. All right. So if you've heard that thrown around, some people think it could be. It's not. The paper that was written that first drew the link between vaccinations and autism was made with fake data. The person who wrote that came out 10 years after they wrote it, admitted that it was fake data. The paper has been pulled from the journal that it was in, and there's tons of studies that show that there's no link between vaccines and autism. There is no link. Don't fall for it. It's not true. I mean, that's a little, it kind of goes in the face of science that this guy lied about it, but he wanted to have a big publication. He wanted to break into the scientific world as one of the head top people, but it's not true. He's done a huge disservice to vaccinations by lying about that, but he did lie about it. It's untrue. That said, there could be something else in the environment that's pushing it, right? I mean, who knows what? We know that mothers getting sick in certain trimesters with the flu are more at risk for having a child with autism. So that could be. Maybe there are more incidences of flu at that term in the trimester. There's all sorts of things that could happen. But one other thing that can happen is doctors might just be more readily diagnosing autism. One thing that happened in the most recent revision of the DSM is that we went from having Asperger's and autism and a couple other things as totally separate diagnoses into having the autism spectrum. So now you can have elements of autism, and a psychiatrist or a psychologist or even sometimes a primary care physician might say, this looks like autism, like pretty far over on the spectrum, not severe autism at all, so almost close to typical, but not quite. And so it could be that people are diagnosing a little bit more. Could be that there's something in the environment, again, not vaccines. It could be both of those compounded. But you know what? Whatever it is, and I mean, it would be a great thing if we knew exactly why, but we don't. But whatever the reason is, 1980, we have the first, cohort of people that are being diagnosed. But let's say that it is that doctors are more willing to give this diagnosis. So we've got a certain amount in 1980, and it's just growing until the present day. And you can see that here on this graph, that the rate of diagnosis is growing. So anyway, what am I getting at here? What I'm getting at is very few between 1942 and 1980, more in 1980, but then the amount is growing. So the point is, even with the cohort being diagnosed in 1980, it's still very small compared to the amount of people that have autism today, the amount of people diagnosed as having autism today. So with every year younger the population is, there are more people that are diagnosed as having autism. So that's another reason why we don't know a lot about aging and autism. We just have so few data points that there's not a lot that we know. Eventually we will, but not anytime soon. Let's say 20 years from now, they'll be close to retirement age. And so then we might, start to see some of these effects, but really we're going to have to wait about, 30. So We don't know a lot, and we might know more later. But what do we know? Not a lot, because even though we don't have a lot of subjects, we also don't have a lot of studies. So look at this graph right here. This is showing the number of publications with people with autism in different age groups. And you can see that there are a lot that don't differentiate between age, and that probably means they're taking people between 18 and 65-ish, because that's usually our subject pools for studies. So not super elderly, but they're also not, giving exact ages. There's a lot for children. There are less, but a decent number for adolescents. There are about equal numbers between adolescents and adults, but then older people, look at this. Not a whole lot. I mean, the scale goes to 1,000, so we might be looking at something like 200, 100, 200, which seems like a lot of papers, but in comparison, it's not. To that total age spectrum up there, it's not. To the 18,000 papers published for the total age spectrum, it's not a lot. Another thing is, they're worried about it. People who are aging with autism are scared about what will happen to them. And one of the reasons for that is they really depend on their close connections. We learned from Maria's lecture that there's not a lot of social connections for a person with autism, unfortunately. And those social connections that they do have are usually family, maybe a few close friends. Most of them just don't happen to have, a family that they've started on their own. So they're worried about what's going to happen when their caregivers get too old to take care of them. What happens when their siblings are in nursing homes too? Who takes care of them? What happens? They're nervous about this. I mean, I would be too if I was one of them. I mean, geez, I'm nervous about who's going to take care of me when I'm old anyway. So I can imagine that would be scary. And then lastly, you can see here that by 2050, we're looking at about 1 million people with autism that are older. Now, I'm of the mind that there's probably not a whole lot more autism really now than there used to be. It was just underdiagnosed because we didn't know that it was a disease, and now, we're finding it. And in some cases, it's possible that some people are maybe being diagnosed that might not need to be, but I'm not sure about that. Don't quote me on that. But it seems like there are some cases that might not necessarily be exactly there. But anyway, it would be nice if we could go back. I mean, we can't. We don't know what people would have been diagnosed with from history, because we can't really see them. We can't have somebody diagnose them. But it would be really interesting to see what people that would have been diagnosed as having autism, how did they cope back before 1942, before we knew that there was anything? What happened with them? What kind of trajectory did they have? Again, that's just like a thought experiment. We really can't know. But what we do know is that there's going to be over 1 million by 2050. All right. So one of the questions that we have is, how do they age? What is the aging process like? Is it the same as typical aging? Is it different? So would you expect that someone who has autism to basically age just like I will, but their characteristics will still be their characteristics, and then we'll both just get old? Or is there something different going on there? Well, We know that some statistics about as people with autism transition into adulthood, we know that a lot of them don't end up with a job, a consistent, well-paying job outside of high school. 32% do, which is great. I mean, I believe that this is taking into account everyone with autism. So again, there used to be a diagnosis of Asperger's. There isn't anymore. It's just something that's on the spectrum. I think it's a subtype, but it's still just on the spectrum. So there are some with less severe deficits or different deficits than others, but this is taking into account all of those. But anyway, 32, roughly a third, have some sort of typical employment. Only 20% have typical living arrangements. So even the ones who might have, a well-paying job or a decently paying job, some of those still live with their parents or their siblings or grandparents or, some non-typical living arrangement. And then a lot of them, over half, have co-occurring conditions. One of the big things, well, Marie talked about a lot of the things that co-occur, but one of the things that co-occur with adult populations are things like diabetes. Seems like that tends to occur slightly more often with autism. And then there's not a whole lot. There's 68%, so roughly 2/3 are involved with some community aspect. So there's a good percentage that are a little isolated. And not a whole ton of them receive services to help them get into jobs or other hobbies or anything like that. Roughly a third get access to those kinds of services. So roughly a third have access to services. Roughly a third have a job. 20% have normal living arrangements. So you can see how there's issues there. And then again, over half have other conditions. So if they have a problem with pragmatics, which is one of the major areas of deficit is interpersonal pragmatics, and problems communicating socially, it's difficult for them to manage their secondary, well, it's not secondary symptoms, I shouldn't say that. They're co-occurring symptoms because they don't necessarily interact with caregivers, primary caregivers or doctors and nurses the same way that we do. So, all right. We are curious about all of these different sub-dimensions of aging, which is an interesting thing to look at. So, typical aging has some similarities with autism spectrum disorder, which is very kind of strange when you think about it, right? So you take someone who is typical, not necessarily typical, but mostly typical, developing, and watch them age, and we'll all end up with some traits as we age that kind of mimic autism spectrum disorder. We'll talk about those in a second, but that poses an interesting question, right? Because if we have people who already have these symptoms, people with ASD, and they get older, do they not gain those symptoms because they're already there? Or do they age the same way we do, so that compounds on top of their pre-existing symptoms? Well, we shall see. I don't necessarily want to leave that out, because we've talked about this. Really, we'll go over it really quickly. This should be stuff that you guys know from the previous lecture, but we'll go over it really quickly. So we know that there are some cognitive deficits in a lot of cases of ASD. There is anxiety, there's sometimes hyperactivity, a lot of times there's inattention, ADD style symptoms. Depression is a large problem. I'm glad we did stop on this slide because I did want to mention that. But depression is a huge issue with people with ASD, not just older adults, but everyone. Children usually deal with depression a lot. Maria mentioned that because even though the social interaction is troublesome, is kind of impaired, they do realize that that isn't something that they have, and so even if they want to interact, they don't know the ways to, but that doesn't mean that they don't want to. You know what I mean? So they're just not as into the cues as the rest of us have learned how to be. And so when they can't interact, but they want to, of course that leads to depression. Obsessions and compulsions, OCD style symptoms, those are also prevalent. Sensory abnormalities, sensory to light. I'm pointing at something that you guys can't see. Sensory to light, or sensitivity to light, sensitivity to different kinds of sounds. Sometimes misophonia, sometimes strange taste and texture issues, like this collar is a little tight on my neck. And let's see, disruptive behaviors, that's fine. Repetitive and restricted behaviors, this is common. We know about that. And then also social communication deficits. So let's focus on those cognitive deficits. What do we see with typical aging? Well, it's kind of focused on the frontal lobe. Hopefully you guys all remember from one of our previous lectures about the brain, frontal lobe, temporal lobe, parietal lobe, occipital lobe. This is the cerebellum, and this is the brainstem right here. So we're kind of focusing on the frontal lobe here. What goes on in the frontal lobe is a lot of executive stuff, a lot of decision making, a lot of attention, like higher decision making, all the stuff that you kind of sit around and think about. So somebody asks you a really complicated question, and your answer is going to take up a lot of those resources in the frontal lobe. So what you can see here, this is a little bit of a simplified map of what happens there, but attention, so focusing your attention on one thing, this is one of the functions of the frontal lobe. Inhibition, so stopping you from doing just whatever you want to do. Planning and decision making. Working memory is governed to some extent in the frontal lobe. And we know from what we just talked about, our typical ASD symptoms, a lot of those seem like things that could be hindered by a deficit in the frontal lobe. So attention. We know that social attention is not exactly where it should be. It's got a deficit of some sort. We know that attention to areas that the person doesn't really want to deal with, that is inhibited too. And then on subjects where they're really interested in it, attention is not inhibited. Attention is very highly focused. And that kind of comes to plays into inhibition as well, right? It's hard for people with autism sometimes to inhibit breaking into a conversation when they have something they want to say. We do this too when it's something really important, but we also know that we shouldn't, so we'll say things like, okay, hang on, sorry to interrupt, but really quickly, I just wanted to say blah, right? So we know we shouldn't, and we have ways to break in when we have to. Otherwise, you kind of make a mental note, like, I want to say this, and then so infuriating when the conversation turns away from the thing you wanted to say, and you're like, oh, it was such a good thing, though. And then you have to, like, try to find a way to, like, bring the conversation back so you can tell that story. Anyway. Planning, kind of self-explanatory. Working memory. Hey, working memory. this is a thing that we probably haven't talked about in here yet. And we will when we talk about different kinds of aphasias and TBI and things like that, but we might as well talk about it right now. Working memory is not exactly the same thing as memory. So let's see. If I told you to memorize... I have nothing around me right now. If I told you to memorize the numbers 5, 4, 9, 6, 2, 0, 5, 3, 9. Now, what were those numbers? That's not working memory. That's just memory, right? Short-term memory. Now, if I asked you 5 plus 2 equals 8, true or false? Go ahead and answer. Remember the number 5. Okay. 10 plus 13 equals 23, true or false? Now remember the number 4. 7 plus 9 equals 16, true or false? Now remember the number 9. 5 plus 5 equals 10, true or false? Now remember the number 6. Okay, what were the numbers? 5, 4, 9, 6, if you're curious. And you probably got that right because we only did 4. But we usually do more. When we do cognitive testing with working memory, we'll test all the way up, usually to 9. Most people stop around 7, being able to hold those in their memory. Some people, different people have different abilities. So it's usually around 5 to 9 with an average at 7. Almost everybody can do 4. 3 is not hard. And obviously 1 is super easy. But that's working memory. So working memory is holding information in the focus of attention while you do some other operation. So you have to kind of divide your attention. You have to hold this thing in memory, and then you have to put your attention on something else, answer a question, and then go back. Now add another piece of information to that list or whatever you have. Then go back and answer something else. Add another piece of information, go back. It's a lot different than just memorizing. All right, so, we talked about this with, what is that group? Lumosity. We talked about it when we talked about lumosity, right? You can't really train working memory. So that's working memory. And that's governed by the frontal lobe. Okay, so we know that with typical aging, all of these functions begin to decline. Attention is inhibited, inhibition is inhibited, interesting choice of words, planning, working memory, and mental flexibility, these are all inhibited with typical aging. Well, guess what? They're also inhibited with autism spectrum disorder. The same lobe, the frontal lobe, is affected by ASD and typical aging. So what you're going to see here is, this is just shrinkage of lobes for people with autism spectrum disorder. So you can see the green here is the frontal lobe. If you kind of average those green bars together, it would be around, I don't know, let's just kind of guess. Probably like 1.3-ish. Average all the temporal bars together, and you're at around 1. Parietal is around, I don't know, 0.6. And then occipital is very low. There's not a lot of shrinkage in the occipital region. So we can see that different lobes are affected differently with autism spectrum disorder. The occipital cortex, a lot of vision is processed there. There doesn't seem to be a whole lot of differences. The temporal lobe is an interesting one. There are quite a few differences there. That is where hearing, speech are processed. But it's also, it's a large area. It's not just hearing and speech. There's some sensory integration towards the posterior part of the temporal lobe. So there's there's also, I think the fusiform face cortex fusiform face area might be in the temporal lobe as well, although it might be in the frontal lobe. It's kind of at the bottom, somewhere near you know what, I think it's in the frontal. Anyway, but you can see that different lobes are actually affected differently. We would expect that some of these are smaller than a typical brain than others. An occipital cortex might be the same, whereas a frontal cortex in someone with ASD is a lot smaller than someone with a typically developing brain. And here is what we see with aging. That is also mostly the frontal cortex that is subject to brain shrinkage. Interesting. They mimic each other, like we've been saying. Well, here's what we know about brain change with age. Of course, again, this is not advanced age. I mean, if you look at the ages here, like this graph on the left goes to 16. This graph on the right goes to 50, which is actually a pretty respectable. Oh, but when you look at where ASD is, it actually goes to about 40. So that would be your first cohort of people from 1980, right? They go up to about 40 years old. So, what do we notice? Well, so what we're looking at here, the solid line is normally developing brains. They're going to pretty much increase their area with age. They increase rapidly until around 3.5. And then they start to level up, but they're still increasing. And it isn't until around 10 that it looks like it kind of plateaus. That's for normal, typically developed person. Someone with autism, however, you can see that this kind of jumps up very quickly. And then instead of plateauing, it actually starts to, move the other way. So it jumps up very quickly, and then it actually starts to decline. There's something called pruning, and that actually might be what's at play here to cause the brain size, the total brain volume, to decrease with autism. Pruning is getting rid of extraneous neural connections. We all go through it. Every child goes through it. But some disorders do it more than others. Autism is one of those that prunes a little bit more. It's called overpruning. Schizophrenia is another one that involves overpruning. And there's another one that I just recently read about that I can't remember. But anyway, these are involved with overpruning. Now, autism and schizophrenia don't necessarily overlap. I mean, you can have people that have both disorders, but I believe that the overpruning is in different areas and it affects the brain differently. So they're related in that they're related to overpruning, but they're not like two sides of the same disorder exactly. That's so I don't want you to leave with that idea. But what looks like happens is the brain grows much faster and then actually begins to go into the pruning process and might prune possibly too much. And then over here, this is looking at adulthood. We're starting around 10. So we're going to go from about where this leaves off to here. So we see that people with ASD have faster shrinkage of the brain in adulthood. So if you follow the blue line, that is our typically developing population. The brain is shrinking, and the red dotted line is ASD, and you can see that they begin to separate and go off in two completely different trajectories. We would expect that these would continue, the gap between these would continue widening. One thing that it looks like, so that's never mind. Sorry, I was gonna say something that I'd already talked about. All right, so we can see that there is brain shrinkage with age, and we can also see that there is brain shrinkage with age for people with autism, but it's kind of compounded by the already visible disorders that they have. It's affecting the same regions as autism. Aging is affecting the same regions as autism. So it's kind of a double whammy in terms of the shrinkage and the the cognitive deficits that come out of that. So, though I say it is a double whammy, what kind of a double whammy is it? Is it like an additive thing? So we might have something where there's normal aging and there's ASD, and those kind of just add together, they're just kind of overlaid, or are they multiplied together where they're actually multiplicatively worse, right? So instead of just added together, they really compound on top of each other. Well, it actually seems like they are multiplicatively involved. So the blue line is your typically developing brains moving into their 80s. You can see that executive function declines. I mean, like it's just a part of the process, unfortunately. But then people with ASD, you can see that they really drop off, getting up here at this area. They start off a bit different, and then the difference is just magnified with age. So it's not that they're additively different. It's not that, the lines are parallel and they just move down. It's that they're intersecting with each other. The age and the autism are intersecting with each other and building on each other and creating more and more profound problems. Okay, so Dr. Blair Braden's lab is actually delving into aging and autism. And one of the things that they've noticed is that they've got studies that show that people with autism have actually thicker frontal cortexes when they have ASD, which is interesting because by the time those people grow into middle age, then they actually have thinner frontal cortices than people with typically developing brains. They control this with the occipital lobe back here, which, like we talked about, there doesn't seem to be a difference in shrinkage with the occipital lobe. So they can show that this isn't just an effect of aging because the occipital lobe is the same. This is an effect of ASD and aging. So it starts out with a thicker frontal cortex, but then it becomes thinner by middle age. I mean, that isn't old age. So we're not even sure what starts to happen at old age with this research. But we can show that there is definitely a difference that's related to aging. I'm going to blow through that because it's possible that Blair and Melissa are still running their research online. If that's true, I don't want to contaminate you by telling you about it. I want you to be able to participate in it if you would like. So I'm going to hold off on this. I'll check with them and see if that's actually still going on. If it's not, we can talk about the Wisconsin card sorting test. It's kind of fun. So let's talk about social communication. That's what we're talking about in the class anyway, right? That's what our whole job is here is communication. So let's talk about communication. Let's communicate about communication. We know that people with ASD have difficulties with these things here, with engaging socially with other people, with maintaining those relationships long term, and also using all the types of communication. Pragmatics, again, is the big problem with ASD, right? So this is nonverbal communication, but it's true with verbal communication too. They've all got pragmatics, and there's a lot of difficulties with pragmatics for someone with ASD. So here's something that we know a lot about. this is what happens with people who have ASD as they age from childhood into young adulthood. So from children into where presumably most of you are, although it's an online class, so I know we're all ages and all different everything. So I guess what I should say is from children to the age of my in-person class, which are, about 20. About 20. So we know that their symptoms seem to alleviate a little as they age. Well, the reason for that is because social skills are made up of all those other things that we talked about, right? This doesn't have working memory, but that is a huge part of communication. We use our working memory all the time in communication. Reasoning, decision-making, judgment, inhibition, attention. Do we have inhibition? Inhibition, but inhibition is very important. Also working memory. You have to remember what you wanted to say. You have to remember what the other person who's not talking right now in the conversation said when you're listening to a third person, so that when you listen to them, you can say, yeah, and going back to what Marcy said about that other thing, that goes with your point about this. This is effective communication, right? So it's all of the things we've talked about, all the areas that there are deficits with ASD and aging, those all go towards social skills. So as a person with ASD ages, as they get older, they become more sophisticated with their reasoning and decision-making, etc. as they become older and have more experience with different social situations. So we know that symptoms can become less pronounced. They'll function more like typical conversational partners. What we haven't known a lot about until recently is what happens as they age beyond young adults. Well, this is what seems to happen as they age beyond young adults. Young adult, middle age are about equal in terms of their the symptoms of ASD, but then as they get into old age, they've come back to where they were in childhood, because we've talked about that. Aging causes some ASD-like symptoms in typical older adults. And so when that happens to people with ASD, you've got this kind of U-shaped curve. So now the social skills are impacted again, because we're seeing deficits in the frontal functions like reasoning, decision-making, working memory, attention. These are being impacted, so then we have reduced social skill function. So this is, here's a couple things that show some proof in that. We've got impairments in older adults. We see that there's increase in impairments in older adults. We also see that there are poorer social outcomes. This is showing, during middle age. These are follow-ups at middle age. This is, I was going to say recent. It's fairly recent, 7 years old. So this is just looking at middle age, 40 to 50, some declining, beginning to decline social skills. And we can interpret that would just continue to decline into older adulthood. So there's a few publications that are bearing this out. Also the work of Melissa and Dr. Braden's lab. And here is the last thing that we'll take a look at. No, I'm sorry. This is not the last thing we're going to take a look at. This is just showing young adults versus older adults. Again, social communication impairment. So what we're taking away from this is the symptoms worsen and social communication is impaired. And we also see at the same time that there is a deficit in this dorsolateral prefrontal area. And this is actually, an area that I've got a paper on about too. That's interesting. Totally different reason, but still interesting. So we see deficits here. The main thing to take away from this is frontal. It's another frontal region. There's decision making going on here, and other executive functions. So we see that there's a decrease in that area, a decrease in the network connections in that area. So neural connections are being decreased. And then again, same thing here. Hypoconnectivity just means a decrease in neural connection. So with older adults, aging adults with ASD, we see just fewer neural connections. You can kind of see that here. This is typically developing people from young adult to middle adult. Again, there's fewer connections. This is interesting. There's a slight increase from young adult to middle adult in the right side. Probably those aren't significantly different. There's probably nothing significant there. But then you do see a very large difference for people with autism. That most likely is statistically different. That's not necessarily on here. Oh, hey, look at that. We do have statistics on here. They're huge. So this would be a statistically different change here. This one, not quite. All right, so this is the last thing we have on here. This is just the same thing again, showing the same thing. But so to sum up, what we see is decreased frontal lobe activity with older adults. What's interesting about that is that's also the same lobe that is affected with autism in general. So as people with autism age, their symptoms worsen because it's affecting the same places that autism is already affecting. What you get is a multiplicative deficit in communication, especially social communication, pragmatics, and all those areas that we expect to be affected by autism. And then to sum up what we talked about in the very beginning, this is a really important issue because there's a lot of people that are going to be going through this, and it's scary for them. I mean, if you put yourself in their shoes, they're already worried about who's going to care for them, and they're in their peak of social function. They're young adulthood and middle age, and they're starting to worry about who's going to care for them. As their symptoms worsen, that's just going to get scarier and more real. In addition to that, we know that depression and anxiety are comorbid with autism, and that is worsened as the condition worsens, but it's also worsened by the fact that their only social connections are starting to move on, not be there, die, and not be around to care for them. So this is a very important area, right, to look into. If this is an area that you are interested in, I mean, it's interesting. It's really interesting, I'm sure, to all of you. But if it's something that you feel like you'd like to actually get involved with, you can talk to Maria Dixon, who did our last excellent lecture on childhood autism. Blair Braden is the one who runs the Autism Lab. Get in contact with her. Her email is on these slides. And you can volunteer in their lab. And possibly by the time you are done with your undergraduate degree, you might decide that you want to go into the clinical master's program in speech and hearing for brain imaging and neuroscience instead of maybe what you had planned on going to, which is most likely becoming an SLP. I'm not saying you should go one way or the other. I'm just saying if this is something that really resonates with you, this is a career path that exists. We're going to learn more about these kinds of things, these kinds of brain things as we go through. We'll talk about TBI, we'll talk about aphasia, I'll talk about some cognitive stuff that is related to that as well, and my research. So anyway, we're kind of hitting all the different majors, right? So there's a lot of speech stuff that we covered last week, and Dr. Weinhold's lecture covers a lot of the SLP kind of things that we need to know. This is the neuroimaging kind of side of things. Towards the end of class, we'll talk about the hearing audiology side of things. So there's a lot of stuff, a lot of things to think about at this point in your college career. Like, where are you going? All right, so that's the end of the lecture, and that's the end of the content for this week. The exam is up. It's due on Sunday. There is a review sheet, so go through that. Slides, actually. There's review slides. Take a look at those slides. Try to answer all the questions on there. I might post a review video, and you can try to answer the questions on the slides, then watch the review video, and if you do that, you should be pretty well set up. Also, go back and look at your quizzes, because that stuff's going to be on the exam. Okay, have a good rest of your week, and hopefully the exam goes well. Yeah, all right.